Hi, this is our presentation for the position statement on management of sport-related concussions.
What is a concussion? Concussions are also referred to as mild traumatic brain injuries. The NATA defines a concussion as a brain injury caused by forces applied either directly or indirectly to the skull, causing the brain to decelerate or accelerate, resulting in injury to the brain. Some other definitions we should be aware of when discussing concussions are post-concussive syndrome, which can be diagnosed when the patient exceeds 30 days of concussion-related symptoms. And then secondary impact syndrome, which happens when a patient already has a concussion and they either return to play or get hit again, making the symptoms they have worsen. And some common sports that you see concussions in are football, soccer, ice hockey, rugby, and martial arts, or any other sports with high contact. Education and preventative measures. So, education and preventive measures should be discussed with teammates, coaches, families, or other people that should be in the know of what a concussion is. And also, some other considerations are socio-cultural, and socioeconomic circumstances of the athlete, and noticing environmental factors like field, weather conditions, or reckless behavior of other people around that patient that can possibly jeopardize that patient's safety. And baseline testing, this is an assessment tool that helps us see normative data of the athlete to compare to post-concussive states. And something we use is called impact test, and this assesses the memorization, recognition time, processing speed, attention span, and multitasking. And also other preventive measures we can take are sport-specific equipment. And this is just to help reduce the risk, but not completely diminishing the risk of concussion. And some equipment you can see are helmets, um, mouth guards, and in sports like soccer, soft helmets or headbands.
So another important aspect of concussions is mental health. So some mental health conditions may include depression, anxiety, sleep disorders, or PTSD. And it's important to remember that as athletic trainers, we are supposed to be providing quality whole person care. So when it comes to that, we're not just addressing the physical well-being of the individual, but also their mental health does play a role in their whole person care. And so it's important that we recognize and know how to treat that as well. Also, educating them on home care. So things that they can do at home, either by themselves or with their families, to be able to help with the mental health and possibly diminish any symptoms that they may have after a concussion. As an athletic trainer, it's important to provide an individualized mental health policy or procedure. So, if you know an athlete has some type of mental health condition disorder from previous testing, then you can talk with them, the family, other health care providers, and come up with a plan for if they do have a concussion and how you can go about diminishing the negative impacts or effects that the mental health may have on that. And then concussions in mental health may cause mood swings or exaggerated symptoms, such as their sleep gets even worse if they have like a sleep disorder, and it also prolongs the recovery of a concussion. So, healthcare teams, of course, ATs don't work alone. They're always working in a team, and each individual has their specific role or designated responsibility for taking care of the athlete. ATs and physicians typically will be the ones that call the return to play, and they're able to say if the athlete can, of course, return to play. Some individuals of the healthcare team include athletic trainers, physicians, athletic training students, coaches, family members, teachers, therapists, and counselors. So athletic trainers, of course, are going to be the first ones there when this injury occurs, so they're able to do the assessing and be able to decide if they think there's a suspected concussion and then refer that athlete to the physician. And then the physician is going to be the one that actually is able to make that diagnosis of if the athlete has a concussion. Athletic training students, of course, they're going to be on the field too, so they can either just learn like how to do the testing for concussions, and you can also, for post-treatment of a concussion, kind of delegate tasks and be like, hey, can you monitor this athlete while they do exercises in the athletic training clinic? And then coaches, of course, need to be aware it's their athletes, they're going to want to know, but make sure to like stay with HIPAA and know what you're saying, basically. So knowing that, like educating them on knowing what they can and cannot do for the athlete and just allowing them the information to know that the athlete is not going to return to play after a concussion. Family members, this is especially important if you are dealing with any minor. The family is supposed or has to be involved in the medical side of the athlete or of their child, and so educating them on that and keeping them aware of the progress that they are making or anything that's going on post-concussion with the athlete. Teachers should just be educated because concussions can impact their cognitive function, of course, so this can affect how they are in the classroom. So just helping teachers be aware of that and know how they can help assist that athlete or that child post-concussion. And then therapists and counselors go back to the mental health side of things. So they're able to be kind of a referral for if that athlete needs some extra assistance with a mental disorder, if it's being exaggerated after a concussion, then you have that resource there for them.
And post-treatment. So after you get a concussion, the first 24 to 48 hours, you should be resting, and there should be no return to play prior to the first 24 hours. Depending on how severe the concussion is, it can vary on the length of time to return to play, but there should be nothing sooner than 24 hours for return to play. You should also be monitoring the athlete regularly. So this includes documenting the progress throughout their concussion and also limiting cognitive and physical activity. And the return to play progression, this is on the NAT position statement, and these are the stages in which you should follow when rehabbing a patient with a concussion. So first is no activity, so this is the resting stage. And second is light exercise with 70% output. And then third is sport-specific activities without the threat of contact from others. And then fourth is non-contact training involving others with resistance training. Fifth is unrestricted training. And sixth is return to play. And also important is stages should be separated by at least 24 hours. And also, if you have any returning symptoms of concussion-related symptoms, you should start over and reassess or restart that stage in the next 24 hours.
So we have a few discussion questions for you guys. The first one is, what precautions should athletic trainers take when implementing physical activity after the initial 24 to 48-hour rest period? And what signs and symptoms should they monitor throughout this phase? And then our second question is, what is the importance of baseline testing and how can this help the athletic trainer assess and evaluate the patient when a sports-related concussion is suspected? And then these questions will also be posted as well. So, thank you.
Thank you.